It often starts with a question you didn't expect to ask. Your period is late, your mood is shifting, your abdomen feels a little fuller, and some mornings you even feel nauseated. You book a gynecology appointment wondering if you might be pregnant, and you learn you're actually entering perimenopause. Nothing is wrong with you. What you're noticing are the natural effects of estrogen and progesterone beginning to fluctuate. Those hormonal waves can delay or skip periods, stir emotions, cause bloating, and, yes, occasionally mimic early pregnancy. Once you understand what's happening, clarity replaces fear. Think of this transition like adolescence in reverse. No one goes to bed a child and wakes up an adult. There is a bridge between those seasons. Perimenopause is that bridge, the gradual passage from your reproductive years to a new, non-reproductive phase. Menopause itself isn't a long stretch of time. It's a single milestone diagnosed in retrospect, when 12 consecutive months pass without a menstrual period. The path to that point can feel messy. Cycles come and go, months of silence followed by a surprise bleed. That inconsistency is part of the process, not a sign that your body is failing. For many women, perimenopause begins somewhere in the 40s, often between 40 and 45, though earlier or later is possible. It can last years. Part of the confusion is that symptoms vary widely. Some women sail through with minimal changes. Others feel like every dial got turned at once. Genetics matter. Lifestyle matters. Smoking, high stress, chronic sleep loss, and significant weight gain can amplify symptoms, while regular movement, nourishing food, and consistent routines tend to soften the edges. When people think menopause, they usually think hot flashes. Vasomotor symptoms are common and visible: flushing across the face, neck, and upper chest, sudden heat, sweat that appears out of nowhere. But the picture is larger. Sleep can fracture, leaving you tired before the day begins. Focus can slip. You walk into a room and forget why. Mood can wobble, irritability one week, a heavy sadness the next, or a sense of anxiety you can't quite name. Weight may shift toward the abdomen. Desire can feel different. Intercourse may start to hurt. You might need to urinate more often, or leak with a cough or a laugh. These genitourinary changes have a name: genitourinary syndrome of menopause, and they're common because estrogen supports the tissues of the vagina, vulva, and urinary tract. When estrogen falls, those tissues become thinner and drier, more fragile, more easily irritated. UTIs can show up more often. None of this means something is wrong with you. It means your body is asking for a new kind of care. Pelvic support can change, too. The muscles and connective tissue of the pelvic floor hold the bladder, uterus, and rectum in place. Over time, and especially after pregnancy, heavy lifting, chronic constipation, or simply as tissues thin, those organs can shift downward. You might feel pressure or a bulge in the vagina, sometimes described as the bladder dropping. That's pelvic organ prolapse, and like most things in midlife, it exists on a spectrum. For some, simple pelvic floor physical therapy and lifestyle adjustments are enough. Others do well with a pessary, a comfortable device that supports the vaginal walls. A minority may choose surgery. There is no single right choice. There is only the choice that meets your anatomy, your symptoms, and your goals. So what helps with hot flashes, night sweats, and the roller coaster of symptoms? Start with the principle of individualization. What are you feeling? What's your medical history? What matters to you? Hormone therapy can be highly effective for eligible women. If you don't have personal contraindications, such as certain cancers or significant cardiovascular disease, your clinician may discuss estrogen therapy, paired with a progestogen if you still have a uterus to protect the uterine lining. Estrogen can be delivered in different ways: oral tablets, transdermal patches, or gels, even sprays. Some symptoms, especially dryness and pain with intercourse, respond beautifully to low-dose local vaginal estrogen, creams, rings, or tablets that restore the health of the tissue with minimal absorption into the bloodstream. In carefully selected cases, low-dose testosterone may be considered for persistent low desire after other causes are addressed. All of these decisions are nuanced and personal. They're made in partnership with your clinician, revisited over time, and adjusted as your life changes. There are also effective non-hormonal options. Cooling strategies, paced breathing, mindfulness, and stress reduction practices calm the nervous system and reduce the intensity of flashes for many women. Regular exercise, especially a mix of cardiovascular work and resistance training, supports temperature regulation, mood, and sleep. Certain non-hormonal medications can help with vasomotor symptoms. Your clinician can walk you through risks and benefits. Acupuncture and cognitive behavioral therapy have supportive evidence for some symptoms. None of these are one and done, but together they form a toolkit you can actually live with. For genitourinary symptoms and sexual pain, local solutions shine. Vaginal moisturizers used several times a week improve baseline hydration. Lubricants reduce friction during intimacy. Local estrogen reverses thinning and restores elasticity for many, easing burning, tearing, and recurrent infections. Pelvic floor physical therapy builds strength, coordination, and confidence, not only for continence but for sexual comfort. And it helps to remember, sex is not one act. Midlife intimacy can be expansive. More time for arousal, more forms of touch, more creativity, more conversation. Desire often grows in the space where pressure and pain are removed. Weight changes deserve compassion and strategy, not shame. Metabolism does slow with age, and lean muscle naturally declines if we don't use it. That doesn't make weight gain inevitable. It makes strength training essential. 2 to 3 sessions a week of resistance work help preserve and even build muscle. That muscle protects your bones, steadies blood sugar, boosts metabolism, and carries you into the next decades with power. Combine it with walking, cycling, or swimming. Aim for protein-forward meals with fiber and colorful plants. Hydrate more than you think you need, and set realistic timelines. Midlife bodies change on midlife timelines. Progress may be slower than at 20, but it's absolutely possible. Emotional health is part of the picture. Sadness, anxiety, overwhelm, and brain fog are common in perimenopause, but they're not always only hormonal. If symptoms are intense or persistent, seek care. Rule out thyroid problems, anemia, sleep apnea, or major depressive disorder. Support your mind the way you support your body. Therapy if you need it, community you can lean on, gentle routines that protect sleep, boundaries that guard your energy. You're not supposed to push through everything alone. One more practical point. Fertility declines in your 40s, but pregnancy can still happen. If you don't wish to conceive, maintain contraception until your clinician confirms you've reached menopause. Hormonal IUDs are especially helpful in this season. They provide excellent contraception and often smooth out heavy or irregular bleeding, which can be a relief when cycles are unpredictable. Other methods, pills, injectables, copper IUD, remain options depending on your health and preferences. If pregnancy does occur in perimenopause, it's considered higher risk for hypertension, gestational diabetes, and other complications, so early, attentive prenatal care matters. Think of your care team as broader than one office visit. Your gynecologist may be your first stop, but a primary care clinician or cardiologist helps assess cardiovascular risk as estrogen's protective effect wanes. A pelvic floor physical therapist supports continence and comfort. A registered dietitian builds a plan you can sustain. A mental health professional helps you navigate mood and identity shifts. A fitness professional helps you train safely and effectively. You deserve a circle of support that sees the whole of you. Culture is changing, too. A generation ago, many women endured this season in silence, sitting near a fan and hoping for the best. Today, women are living 30 or 40 years beyond menopause. We are starting new careers, building new relationships, raising grandchildren, traveling, learning, laughing, lifting. With that longevity, quality of life matters. Conversations about perimenopause and menopause are getting louder, kinder, more practical. The message is not endure it, the message is live well through it. If you take only a few truths with you, let them be these. Perimenopause is a transition. Menopause is a single milestone reached after 12 months without a period. Symptoms vary wildly from woman to woman, and your experience is valid. Relief exists, from hormone therapy for those who are candidates, to local treatments, to non-hormonal strategies and lifestyle tools that truly help. Don't guess alone. Partner with your clinician to tailor care and to rule out other causes when something feels off. And above all, remember that you are not your symptoms. You are resilient, adaptive, and worthy of feeling well in this season. Breathe. Drink water. Move your body. Lift something a little heavier this month than you did last month. Feed your muscles and your mind. Protect your sleep like it's sacred, because it is. Tend to your relationships and your joy. If intercourse hurts, say so and get help. There are answers. If the scale shifts, train for strength and stamina. Your future self will thank you. If your mind feels foggy, be gentle, get curious, and ask for support. This isn't the end of anything that matters. It's the beginning of a wiser rhythm. Share what you've learned with a friend who needs reassurance today. And if you're looking for a place to keep learning, to feel seen, and to move through this transition with grace, stay with us. We grow here, one honest conversation, one thoughtful choice, one compassionate breath at a time.